This is Dr. Paul Thomlinson from Compass Health Network, and I'm doing a continuing series through which we seek to inspire hope and promote wellness by addressing key concerns arising from the COVID-19 pandemic, and to maybe help us all get through this crisis with some grace and humanity. I'm bringing some evidence-based psychology and other science-based understanding to many of the issues afflicting us these days. This is a two-part episode on grief and bereavement in the time of COVID. This is a very personal one for me, as I'm sure it is for many of you listening. It's been a tough year for my family on the grief and loss front. I come from a family of 9 siblings, and we lost 2 of our older brothers, Mark and Sonny, in the space of 9 months, which is a heavy burden of grief in a short time. Our oldest brother, Sonny, died suddenly and unexpectedly in late February of 2020. And as we have always done in my large, loving family, we gathered close together, pulling each other in tight to give him a fitting send-off with music and storytelling and lots of hugs and tears and sharing of food and celebrating his life. I've been reflecting on how it would have been if he'd passed only a couple of weeks later. None of that would have been possible, and I know for certain I and my entire family would have had our grief intensified rather than relieved, our needs for closeness and sharing cruelly truncated. So to borrow the title from Sheldon Van Auken's great book, it somehow feels like a severe mercy that he left us when he did. I have friends who've lost family members during this strange time, and I've seen extraordinary acts of creative kindness flourish to support those who are suffering extraordinary grief and loss. I have a dear friend going back to my youth whose husband of 30 years has received the same advanced cancer diagnosis that took my brother from us so suddenly in February. The prognosis is not good, and he may not survive past the time of our stay-at-home orders and enforced social distancing. So for them, there are lots of decisions to be made, lots of physical, emotional, and spiritual waters to be navigated in isolation. One thing we know from previous research is that cancer patients have substantially better quality of life and length of life when they receive group-based social and emotional support. So this isolation is particularly cruel right now. I asked my friend her thoughts and concerns about all this happening right now. Her answers are profound. She said, "I think my main concern is the obvious one with the virus. He has a support system out there, but not here. Friends, family, co-workers cannot and should not see him face to face. No smiles, no laughs, no reminiscing and stories being told, no hugs, no kisses. In essence, no energy exchange, and no distractions when he could desperately use some. He cannot go anywhere he's always wanted to go, or even do what he loves, golf and baseball. If he has to go to the hospital to die, I will not be with him. He will be alone. There will be no funeral, no gathering or memorial. Nor can I get away, find support and distractions of others' company, places or hobbies outside the home. Again, no hugs from others, no exchange of energy with friends." She closed her thoughts with this: "Right now, I mourn what he is not getting, to die as well as he has lived." And there you have a gut-wrenching description of complicated grief. In the remainder of this episode and the next, we're going to hear from an expert on matters at hand, complicated grief in the time of COVID-19. I'm fortunate to count as friends and colleagues some of the best experts around, and that's certainly true with this topic. From our respective homes, I spoke with my longtime friend, former next-door neighbor, and co-founder of Lost and Found Grief Center in Springfield, Missouri, Dr. Karen Scott. Karen is a licensed therapist and has over 30 years of experience working in grief and loss. She's also recently published a couple of pieces in the Springfield News Leader on how the COVID-19 pandemic is impacting bereavement and grief. So I could think of no one better to ask a couple of questions about the subject. Karen, you've written that COVID is leading to an onslaught of complicated grief. Can you tell us a little bit about what you mean by complicated grief?
Complicated grief is grief that is not recognized by other people or doesn't receive the social support and emotional support that is needed in grief. It can also be grief that is delayed because circumstances lead to not having those normal rituals and ways in which people can acknowledge the grief.
Thank you. That certainly makes sense. And I think we can all see how the current circumstances could lead to a lot more of that. So the next question for you is, what are the main ways that grief is being complicated right now by the pandemic?
The current situation we're in with the pandemic and the mandates for physical distancing complicate grief because families are not able to be with loved ones who are dying if they have COVID. Many of them are not able to visit families in nursing homes or the hospitals who are dying. Once that death occurs, they're not able to gather in the normal rituals that we have, such as visitations and funerals. So sometimes they're having smaller ceremonies and delaying maybe a memorial service, or they're just not sure what they're going to do. So people don't have those normal ways of offering support, and they come away feeling very empty, like they've not appropriately acknowledged the importance of their person. Additionally, when everyone that might have offered the support system is overwhelmed just in trying to cope with the current social circumstances, many people are struggling financially, they're stuck at home, they're trying to homeschool children, and life is overwhelming them. So they don't have the capacity, or maybe just don't even think, to reach out to people who are grieving. We're so awkward with grief in our society that people just kind of don't know what to do if you don't have those normal services. And then finally, people are overwhelmed in regard to time. And so it may be in the back of their mind that they're going to reach out, but they never get to that because every day feels like a new day with new news and new complications in life. And so sometimes the people also who would have been the people they relied upon, that they've always been able to count on, those people simply are not available because they're wrapped up in their own grief.
Thank you, Karen. You've given us a good picture of what complicated grief is, and we have a very clear picture of how the pandemic is contributing to so much of that at the moment. In part 2 of this episode on grieving in the time of COVID, we'll go back to Dr. Karen Scott for more on the importance of ritual in bereavement and also, importantly, strategies for dealing with the awful circumstances so many are being faced with right now. Now, to close, I'd like to go back to my friend I introduced you to earlier, the one whose husband has just received a terminal cancer diagnosis. This is a hopeful thought from her in the midst of this darkness. She said, "I think the big picture of the virus is we will all come to appreciate human contact a bit more and hopefully be more conscious of how crucial that contact is to our survival as a species."